Hello there, I'm Andrew. After all these years, what still keeps me up at night is seeing what my fellow Americans go through in the exam room. In this country, heart disease is killer number one. But the real tragedy isn't just the statistics, it's the silence. I see it all the time. A 60-year-old neighbor out there playing golf or mowing his lawn feeling just fine until he suddenly collapses from a heart attack he thought was just a bad case of heartburn. I'm not here today to bore you with dry medical jargon or talk about pill bottles. I want to talk to you about the whispers of the heart, the miracle in your chest. Do you realize you're carrying a miracle inside your chest? Think about it, an engine, no bigger than your fist yet. It thumps away about 100,000 times a day. It pumps thousands of gallons of life to every single cell in your body, and it hasn't taken a single second off in 60, 70 years. That is your heart. But here's the honest-to-God truth. In America, we tend to take better care of our cars than our hearts. When the truck makes a funny noise, we're at the mechanics by noon. But when our chest feels heavy, we just shrug it off and say, must be that chili I had for lunch, or I'm just getting old. That indifference is a gamble, friend. And today, I want to make sure you win. This isn't about scaring you. It's about helping you decode those SOS signals. Your heart sends signals so subtle, they're easy to miss. Real life isn't the movies. We've all seen it in the movies. A man clutches his chest, winces in pain, and falls over. That's the Hollywood heart attack. But in my clinic, it rarely looks that dramatic. The real killer usually tiptoes in. I had a patient named Linda, 55 years young. She didn't come in for chest pain. She came in because she felt unusually wiped out. She told me, Andrew, I just walked to the mailbox and I feel like I ran a marathon. She also mentioned a dull ache in her jaw. You see, men and women experience heart attacks very differently. For the gents, it's often that classic feeling of an elephant sitting on your chest. For the ladies, it can be much sneakier, shortness of breath and nausea, or even just pain in the upper back or jaw. Linda almost went home to take a nap, but I kept her there for an EKG and we found a 90% blockage in her artery. That tiredness was her heart whispering, I can't breathe. So here's your first lesson. Don't wait for the big pain. Listen for a sudden drop in your energy. If you're huffing and puffing on the stairs today, when you were fine last month, give your doctor a call. The thief in the night, hypertension. Now, besides pain, there's an even craftier enemy. It doesn't ache, it doesn't itch, and it won't make you tired until it's too late. We call it high blood pressure. Imagine your blood vessels are like an old garden hose. If you turn the water pressure up way too high for 20 years, what happens? The hose stretches, it cracks, and the lining gets damaged. That's when cholesterol, the gunk, moves in to patch the cracks, eventually clogging the whole thing up. In this country, 120/80 is the gold standard. But so many folks walk into my office at 150/90 and tell me, but Andrew, I feel great. That is the most dangerous lie you can tell yourself. High blood pressure is a silent saboteur. It hardens your pipes and wears out your heart muscle. Believe me, you don't want to wait for a stroke to start caring about those numbers. Do me a favor, buy a home blood pressure monitor. Check it in the morning. Keep a little logbook. It's the simplest way to show yourself some love. A matter of the soul. We've talked about the mechanics, but let's talk about the soul for a minute. Do you believe a broken heart can actually hurt? In medicine, we call it broken heart syndrome. When we lose someone we love or face a massive shock, those stress hormones can literally stun the heart. At our stage of life, the 60s, the 70s, we face more goodbyes. Loneliness, worrying about the bills, or feeling left behind. That all weighs heavy on your heart. I want you to know protecting your heart isn't just about cutting back on salt or hitting the treadmill. It's about letting go. It's about forgiving old grudges and finding a reason to laugh. Studies show that folks with good friends and a sense of humor have much lower heart risks. Call an old friend. Join the local garden club. Don't let your heart beat in an empty house. A warrior's request. My friend, your heart is the bravest warrior you'll ever know. It beat when you first fell in love. It raced when you held your first child, and it's beating patiently right now while you watch this. Don't ignore its whispers. Don't ignore those numbers. And don't let sadness wear it down. I have a little homework for you this week. Go for a 30-minute walk. Not to lose weight, but just to feel that rhythm in your chest. Say thank you to it for being there all these years. I'm Andrew Collins. We're all getting older together, but we're going to do it with healthy hearts and plenty of love to go around. Be sure to subscribe to Live What's After 50 so we can keep these chats going. I'll see you next time.